By now, you've heard of the amazing benefits of semaglutides or GLP-1s. So what are the benefits? What are the risks? That's what we'll be talking about today. Hello and welcome to Living Well with Robin Stoloff, empowering you to live a healthier life. I am so pleased to welcome endocrinologist Dr. Samar Bursher. She is the owner and medical director of NutriaMed Metabolic Lifestyle Center in Egg Harbor Township, New Jersey. Thank you so much for being with me today.
Thank you.
So you utilize this medication in your practice. Tell us about the history of this drug, how it's working for people, and some of the positives and some of the things we should be aware of.
Absolutely. So those are the most single talked about drugs, I feel, in history of pharmaceuticals. They're getting all the attention. So what's all the hype about semaglutide and tirzepatide? So I'm just going to give a very quick overview about what are these medications. So these medications are called GLP-1s and GIPs. So GLP-1s and GIPs are hormones that are naturally produced in our bodies when we eat. They're produced from the gut. And what we know about them is they help suppress your appetite. They help make your body produce more insulin, lower down the blood sugar. So naturally, they started out as type 2 diabetes medications. But with observation, we've also started noticing that patients on these medications are losing weight and they're maintaining that weight loss if they're remaining on their medication for a long enough time. So then the FDA approved them to be used as weight loss medication. So this is a little bit of an overview what these medications are. There are a couple of types of these medications. So there are two major types. The first type is GLP-1 medication. And of course, semaglutide is the most famous of this group, although this group came to the market maybe 20 years ago. Semaglutide is branded as Ozempic for diabetes and Wegovy for weight loss. They are the same exact medication. The only difference is in dosing and branding. And then you have the next type of these medications, which is the GLP/GIP, which is a product that works like both of these hormones combined together. And that's the newer brand, which is Munjaro for diabetes and Zepbound for weight loss. And again, the only difference is the branding and the dosing.
So, okay, people are really touting the benefits of this. It's sort of like a quick fix to lose some weight. And that is not the way we should be doing this. Talk about how you should actually take these medications, who should be taking them, and the responsibility of the medical profession to make sure they're administered correctly.
Absolutely. So people reach out to me all the time to ask me if they're a good candidate for these medications. And my answer is, if you have a genuine need to lose weight, or if you have diabetes that is difficult to control, if you're walking around with a high percentage of body fat and a lot of excess body weight, then these medications are appropriate under the correct medical supervision, and they can be life-changing and life-saving for such a person. But on the other hand, if we take another scenario, if somebody reaches out to me, which happens all the time, and they want to lose 10 pounds for their vacation, but they don't have a genuine need to lose weight, they don't have any or just minor excess body weight that could be maybe handled by slight changes in diet and exercise, then this is not the most favorable scenario to use these types of medication.
What is the mechanism by how this works? I am under the impression, and I think I'm correct, that basically what it does is limit your appetite. So you don't want to eat as much. It's not some magic pill that actually makes you shed fat. It actually makes you eat less. Is that correct?
Correct. So that's part of its mechanism. So it works by improving your insulin secretion, lowering down the amount of sugar your body produces, and so lowers down your blood glucose. On the other end, also, it does help with appetite suppression. And that's only one of the minor ways why it's so effective for weight loss. But the other effects on weight and metabolism are much wider than that, and they're still not very well known. So we don't really know exactly why does it help this much with weight loss.
What are you seeing in your patients, and how do you make sure that this is being administered correctly. It's not just the injections once a week. You also have to change your lifestyle along with this.
Absolutely. So it all has to do with the proper medical supervision. So remember that every time you lose weight, you're going to lose fat, but also you're going to lose muscle. And this is true as we age. You can slow that down and lose weight properly by the proper nutrition, high protein diets, the proper exercise and fitness plan, and under medical supervision. This is why at NutriaMed, we focus on laying down the proper foundation of health and fitness. This, combined with added on medications when they're appropriate, guarantees your long-term success. Our nutritionists and trainers work with each person individually to meet those needs.
And what are you seeing as far as results from your patients? Is it difficult for them to make these lifestyle changes, or are they excited about doing it and stick with the program?
So most of our patients are usually very excited about the program. They love working with Allison, our nutritionist, and our trainer, Sloba. Is it difficult to change your lifestyle? I think the first steps of any change is difficult, but we try to simplify that as much as possible at NutriaMed. So it's a really guided journey because we want to be your cheerleaders. We know that you're stepping in, you're trusting us, you're starting a new journey. So we want to be there for you. Understanding each patient's needs individually, individualizing therapy is crucial for success and readiness. So our team, Allison, our nutritionist, and Sloba, our trainer, are one of the best people that you could work with. And we're lucky to have them both as part of our team at NutriaMed. So when we're entrusted with somebody's health, we guide them through this journey of fitness, of knowledge, of nutrition, to be able to empower them with the proper tools, including medications as well, for long-term success, so that if they think about coming off some of these medications in the future, they will actually be able to do so under the proper supervision. So yeah, patients are usually very excited. Are they nervous? Absolutely, because committing to any change can cause a lot of nervousness and anxiety. But we make sure we help you and guide you through this journey. We're there for you. We work as a team. We cheer you along your way.
And so when people make those proper lifestyle changes, they can begin to wean off the medications and hopefully eliminate the medications altogether and have a healthier and happier lifestyle at that point.
Yes, that is the ultimate goal.
You don't really want to stay on these medications forever. Is that right?
If the benefits outweigh the risks, you can actually stay on the medications as long as you're tolerating them very well and as long as you're under the proper medical supervision. But it's usually our ultimate goal to try and get people off the medication when they have achieved their goal weight, but plus when they have learned and gained enough tools to make sure and to guarantee they can take care of their own health and they can maintain all the hard work they put in to lose the weight.
We know a lot of the benefits, but what are some of the risks? And is there anyone that should not be taking these medications?
Yes. So the risks, because a lot of their function is on the gut, are mainly related to gastrointestinal side effects. The most common being nausea, bloating, and either constipation or diarrhea. And there's a lot of ways to minimize these, and we usually discuss that with our patients. Other side effects that are common are tiredness, which usually wears off after a few weeks of use of the medication. Plus, these medications are titratable, which means we work our way up very slowly to be able to minimize these side effects as much as possible. As for contraindication, the major two contraindications are if somebody had a past medical history, something we call pancreatitis, which is a severe inflammation of the pancreas. And then the other one is if you have a personal or a family history of a rare type of thyroid cancer called biliary thyroid cancer or MEN syndromes, which are rare familiar disorders.
So very important to be aware of that. And most important is to work with a reputable medical professional like yourself who's going to administer these in the proper way and also work with you regarding your lifestyle changes, your nutrition, your fitness, and your overall habits, because that's the ultimate goal, is to change someone's habits for life so that they can do this hopefully on their own down the road.
Absolutely.
All right. Thank you so much for joining me. And if someone is interested in speaking with you and would like to reach out and learn a little bit more, where can they reach you?
So they can reach us at NutriaMed.com or call us on 609-415-2888.
All right. Thank you so much for joining me, Dr. Samar Bursher, owner and medical director of NutriaMed Metabolic and Lifestyle Center in Egg Harbor Township, New Jersey. And thank you for being with me today for Living Well with Robin Stoloff. I hope you all like and subscribe and give me a review, and you'll stay updated on my most recent episode. Thanks again for being here for Living Well with Robin Stoloff, empowering you to live a healthier life. I hope to see you again next time. Until then, keep living well.